Hi guys, this is Sam from AspireMRCOG. I'm trying to record a Urogyne history and trying to see how soon we can do it. So let's get going. I will start a stopwatch to see how long is it taking me. Okay, so hi, my name is Dr. Shekhar. I'm the ST5 in the clinic today. May I take your name and your age, please? And how would you like me to address you? Thank you, Lisa. Um, Please call me Sam. So you said you're 62 years of age, and I see that your GP has referred you because you're having some urine leaks. Is that right? I'm sorry to hear about that. Is there anything in particular that you want me to address today, or you want just to discuss the management of this? Okay, yeah, sure, we can do that. Absolutely. Would it be okay if I asked you a few questions to understand the problem and then we can discuss the management options? Yeah? Okay, good. Thank you. I'll write back to your GP. I'll give you some website addresses as well, Lisa, and I'll give you some written information to go through. Okay? Yes. Thank you. So tell me more about these leaks. Since when is it happening? 2 years. Okay. Sorry about this. And how many times do you leak in a day? Several times, like seven, eight. Oh, okay. That's a lot. And can you tell me when does it usually happen? Is it like related to when you cough or sneeze or lift some weights? It does happen with that. How about when you're wanting to go for a wee? Does it happen even then? Okay, so you can't wait to get to the toilet. Oh, that's bad. Yeah, okay. Are you sexually active at all? You are, and does it happen during the sexual intercourse? You have leaked few times during the sexual intercourse. I'm sorry about that. That must be, yeah, I can understand. Yeah. Yeah, this is affecting your quality of life. We should be able to help you. We need to do something to help you. Mm. Tell me if there is any blood in your urine. Have you ever seen any blood in your urine? You haven't any pus at all? No. And do you feel any burning, stinging, or any pain when you're passing urine? No. And you said you do leak during sexual intercourse. Is there any pain during sexual intercourse or any bleeding after the intercourse or no problems like that? Or you do feel dry? Okay. So that can be sorted. Dryness, if we address the dryness part, that will actually improve the urine symptoms as well. We can sort that out. Okay, that should not be a problem. So, any any problems with opening the bowels at all? Okay, and no problems, no constipation or okay. Uh, and do you have any children? Okay, within three, yeah, normal deliveries. And okay, so the youngest is 40 now. They have got their own children. Okay, yeah, but they were normal deliveries, not difficult ones. There were no instruments that were used. Okay. And Lisa, are you aware of your height weight ratio? Is 23? Okay, that's normal. Yeah, that's good. Yeah. Okay. So now, do you have any asthma or any cough that? No. Okay. You think that, and you don't smoke, do you? Okay, that's good. And do you drink alcohol? Okay, only socially. And fizzy drinks? You do drink lots of fizzy drinks. Okay. Um, yeah, okay. So we should probably, you know, we'll advise you a kind of a healthy dietary habits. They always help with the urine symptoms. Um, we can talk about that, and we'll give you some, will dietary advice as well. Okay. Some written information. Okay. Did your GP give you a bladder diary? Okay. Oh, they gave only yesterday, and you had an appointment now. Okay, so you please fill that in, and we should be able to go through it with you when you have it. Okay. Um, and now you are menopausal, yeah, and You suffer from any problems related to, you had any, you said you do feel lots of dryness down there, okay? Yeah. What about cervical screening? Have you been up to date and normal? Okay, that's good. And you don't have any other medical conditions, do you? No, no diabetes, yeah? And any operations in the past in the tummy or down below? No. Any family history of cancer, clots, or no? Okay. Any allergies? Do you think you're well supported at home? Yeah. You live with your husband? Yeah. Okay. Yeah. And any in past few weeks, any feeling of down, depressed, or uninterested in doing anything? No. Okay. Thank you so much for for these details, Lisa. Thank you. Okay, so this has taken me 5 minutes and 30 seconds. We need to shrink this one. This is, I would say, this is better than people who are doing in 7 minutes, and I'm sure it can be shrunk further. I'm sure it can be, can be brought down to say 4 or 4.5 minutes, but because my exam practice is a bit old as well, and in the clinics, we see we don't really rush that much in the clinic, so we have plenty of time in the clinic to ask. So it's not a 10 minute, um, you know, 10 minute history in the clinic. So that's why I would say if I tried to go through this, and if I tried to make, um, if I tried to keep practicing, it could probably be shrunk down to 4.5 minutes. And I think just focus on that. Maybe you guys can make use of these questions. I'll try to share the questions with you guys, and you can then you can then many of you would be much faster than me. Really, I'm not very good with my speed anyway. I keep telling to my students that I have been kind of a very chilled person. I don't rush, and I speak very you know what should I say, in a comfortable tone. No rush, unrushed. I speak unrushed. But if somebody can add a little bit of rush, that would be fine. It doesn't have to sound like a speed train. That should be fine, okay? So I'll share this anyway and see how does it help anyone.